Working at Cairns Hospital as an intern is an experience that you won't get down south in the bigger cities.
I've been fortunate enough to experience a wide variety of different clinical presentations and the interactions that you get to have with the patients on a day-to-day basis is really rewarding. We deal with a lot of underprivileged populations, a lot of transient and migrant populations.
You have the chance to work in a variety of different wards, as well as the Royal Flying Doctor Service, which is a highly coveted rotation.
I don't think you'd get sort of that opportunity anywhere else, and it's been a lot of fun so far. You go out to clinics in towns where the biggest population is probably 300, and most of them are much smaller. You do a lot of primary healthcare based things. You see your own patients, manage them as best you can. You pretty much feel very independent compared to what you would in a hospital, and especially because you've sort of got to make the decision there. You can't really wait because they're probably not going to see you again for a couple of weeks. All the doctors here have been absolutely brilliant, and of course the nurses, they're all really skilled. They've got backgrounds across anaesthetics, ED consultants that are now doing primary healthcare or retrieval medicine. They're very knowledgeable and they're very open to sort of helping me, and they understand that I'm at the sort of infancy of my career, and they're always trying to help me progress and give me a lot of education, like a lot of chance for reflection on most of the cases I've seen, and if I've got any queries, questions, they're always there to help.
Cairns Hospital has quite a significant focus on education, not only internship wise, but they then continue that on for RMOs. Instead of the required one lot of teaching a week, we have two. And in addition to that, they have a focus on procedural skills.
I felt as though, as an intern here, I was very supported from all of the different bosses. Whenever you had a question or a problem, they were always very approachable. I felt as though you could call them by their names. They really knew you not just as a number, but as a human being and as a doctor.
My first impression was that everyone was really lovely. I had that really sort of small hospital feel about it, obviously. Within the space of a day, you're dealing with primary health care, you're dealing with emergency presentations, you're dealing with sick patients that have been admitted to hospital, and then also a variety of sort of aged care issues that come up with the residents. So yeah, I think that's probably been the biggest thing.
Coming to Cairns as an intern was made much easier by the hospital. They provide 3 weeks of accommodation when you first arrive and pay for your relocation expenses. Cairns Hospital is located right on the Esplanade, which is beautiful. The cost of living around the city is quite low compared to bigger cities, so it's easy to find somewhere to live that's in walking distance of the hospital.
The natural beauty of this area is just amazing. Driving like between Babinda and Cairns even, there's just the gorgeous mountain ranges with clouds, there's so many waterfalls, there's the reef at your doorstep. Fantastic food as well, actually.
The weather up here all year round is phenomenal. Nearly every weekend we'd go out as a group, we'd go and explore what this region has to offer, and it would just supplement our work stresses with a great outlet.
It's a beautiful place to live so far, and I think it'd be a better opportunity if you wanted to really get some one-on-one time with patients.
Definitely come. I have not regretted it for a second.
Second to none.
The work that I've been able to do at the Cairns Hospital has been rewarding and has really cemented in me the reasons why I became a doctor in the first place. Wouldn't recommend going anywhere else.